There's a controversy with probiotics. Some practitioners like to use them. Some others say they make things worse. So, what are your findings? Are probiotic effective in controlling SIBO?
Yeah, probiotics are a bit controversial. That I think there's some cultures of some SIBO patients turned up with lactobacilli. And so the idea is that we don't want to add fuel to the fire, and we don't want to add that bacterial load that's already there. So we do have to be careful with some probiotics. On the other hand, there are some probiotic species that have been studied, and there's some benefit with using them, and even some help in treating SIBO. Some of the strains, there's Bacillus clausi, there's Lactobacillus plantarum, and there's a few other I can't think of off the top of my head. So if we're going to use a probiotic, I'll just make sure that it's in the list that has been studied to have some benefit and not potential risk. It also depends on just how the patient reacts. So even if I'm going to use one of those beneficial bacteria, I just watch the patient, make sure that they're reacting well and that it's not causing more symptoms. Yeah. It's also important for a patient to avoid the prebiotics, right, that often come along with the probiotics. And the prebiotics are thought of as the food for the probiotic. So if we're trying to colonize good bacteria in the colon, sometimes important to put a prebiotic in there because they're going to grow better and that's going to be beneficial. But with SIBO, the prebiotics actually tend to feed that bad bacteria in the small intestine and cause more issues. So it's important to avoid those prebiotics when someone has SIBO.
Yeah, many probiotics come along with prebiotics like false gauze, stuff like that, right? So you gotta be careful not to choose a probiotic with one of those prebiotics that could make things worse.
Yep, exactly. Yeah. And ironically, because patients have digestive symptoms, a lot of them have reached, a point where they're trying a lot of things over the counter. And often they come in with things like prebiotics or other things that are actually aggravating the SIBO.
Exactly.